I'm here with Kerry Peck, a great friend to IICLE and a great friend to all of the lawyers in the state of Illinois, past president of the Chicago Bar Association, a person that really understands the law and Alzheimer's. And I know you're writing a new book on that, is that correct?
I am writing a book on Alzheimer's Alzheimer's disease and the practice of law, and I recruited Rick Law of Law Elder Law to help me do that, and we're scheduled to turn in our galleys fairly soon and hope to be to press sometime in the fall. The American Bar Association came to me and asked me to undertake this project basically as a resource guide for lawyers throughout the country. With the aging of America and the number of people that are now afflicted with Alzheimer's disease, we hope that it's going to be on lawyers' shelves throughout the country.
And you serve on the board for the Alzheimer's Association here in Illinois, correct?
Correct. I serve in the Greater Illinois Chapter Board of Directors and quite active in that organization for advocacy. I serve as chair of the National Academy of Elder Law Attorneys Political Action Committee and have been on the board of that organization as well. And quite active in legislation matters that affect older adults at the state and federal level.
Well, and it's, you know, I know you and I are at that point where we're looking at, you know, it becomes a real situation for all of us in terms of just the advent of this particular disease and dementia, how many people it's touching right now. And I don't think there's any families that are going to be immune to this as you get into your 30s and 40s and 50s and you're practicing, and then obviously we're heading in that direction ourselves. How that's going to affect us and what's going to happen there. So,
yeah, it's a growing problem. It has the potential to be the most expensive healthcare disease facing America when you factor in the amount of time it's going to take to assist and be care providers for older adults afflicted with Alzheimer's disease. And of course, the disease itself lasts so long, and it's a progressive declining cognitive impairment disease that causes individuals to, ultimately lose the ability to, certainly know where they are, who their family is.
Right.
So it's a devastating illness that affects not just a person that is afflicted with the disease, but the family who loves them as well.
You know, in terms of what lawyers need to know, I mean, I've listened to you speak so many times, and you're so understanding of, many, many different aspects of it, which include the medical diagnosis of it and how that actually affects the lawyer. But what does a lawyer really need to wrap himself around, he or she, to understand what the pratfalls will be as they're helping clients that are either affected by this disease or families that are affected by the disease?
Well, I think that, from an ethics standpoint, lawyers need to become very familiar with Rule 1.14, which is a critical rule in terms of setting out the guidelines and parameters that lawyers must comply with when dealing with someone that might be cognitively impaired. In addition, the American Bar Association Commission on Law and Aging has put out a book relative to the guidelines for dealing with individuals that may be impaired, and it was done in conjunction with the American Psychological Association, so it's got some great information. Could be a desk reference for our profession as well. So I think that lawyers need to become acutely aware of both the ethical considerations as well as the medical considerations, and then kind of take those two, put them together, and practically apply the experiences that they're having as they encounter more and more clients and potential clients that may be cognitively impaired.
Well, I want to personally thank you for your work, not only in this area, but in your work for us at IICLE, but your work for not only all the lawyers in Illinois and the lawyers throughout the country with this new book coming out, but also for their clients, for those particular families that are affected by these issues, and really helping us to raise the bar for what lawyers are doing in the community and across the country in terms of their usefulness. I mean, if we really look at some of the things that's going on, lawyers are just such great people in terms of helping to solve problems. And sometimes the reputation gets out there that is adverse to the idea that a lawyer is a good person. And I tell you, the one thing that I'm most impressed by meeting people with you and working with people like you all of these years is how impressed I am by how much lawyers give back to the community. And and how selfless they are in terms of sharing that information to raise the bar for all the lawyers.
Well, I appreciate your kind words, and I think that you're right. Lawyers as a profession are not given the respect and the credit that is due because, as you point out, lawyers give back a lot in time, energy, and money to the community on a very regular basis.
Well, and you indeed are an icon to us in that particular area. Ladies and gentlemen, Kerry Peck, read that book on Alzheimer's. It's going to be a great one.
Thank you, Patrick.